Welcome to the lesson on stroke. In this video, we will discuss signs of stroke and steps to take to care for someone having a stroke. A stroke, or sometimes called a brain attack, is a medical emergency caused by a blocked blood vessel or bleeding in the brain. Individuals experiencing a stroke will have noticeable neurological deficits, such as slurred or unintelligible speech, facial droop, numbness, weakness on one side of the body, difficulty walking or maintaining balance, loss of vision, severe headache, and/or loss of consciousness. Stroke is a neurological emergency, so time is critical. If you suspect someone having a stroke, immediately call 911. Help the individual sit or lie down. Retrieve an AED and a first aid kit. Record the time that the neurological symptoms were noted and the last time the individual was free of symptoms. Be prepared to perform CPR if needed. This concludes our lesson on stroke. Next, welcome to the lesson on seizures. In this video, we will discuss signs and causes of seizures as well as what to do when taking care of an individual experiencing seizure, and steps to take after the seizure is over. Seizure, a sudden surge of electrical activity in the brain, or seizure-like activity is caused by epilepsy, low blood sugar, head injury or trauma, heart disease, ingestion of a toxin, or heart-related illness. Seizures result in abnormal body motion due to an irregular electrical discharge in the brain. Seizures can involve one or both sides of the body. Many seizures result in rhythmic jerking motions, but some seizures may result in a blank stare type of behavior. An individual having a seizure may fall to the ground, bite their tongue, and lose control of their bowel and bladder. Seizures are often accompanied by a brief period of unresponsiveness. When caring for an individual experiencing a seizure, help them to the ground if needed. Clear the area around them to prevent injury. Place a small pillow or towel under their head, and call 911. After the seizure is over, feel for the individual's pulse. Position them on their side to reduce the chance of choking on vomit. It is possible for them to throw up after a seizure. Stay with the individual until help arrives. Do not attempt to restrain an individual having a seizure. Also, do not try to open their mouth or put anything in between their teeth. Someone experiencing an absence or staring type seizure will have their eyes open, but will not respond to you. These episodes are generally brief and not associated with jerking body motions or loss of consciousness. This type of event should be treated like any other seizure and be evaluated medically. This concludes our lesson on seizures. In this video, we will discuss causes, signs, and symptoms of shock, and how to take care of an individual experiencing shock. Shock can be caused by overwhelming infection, blood loss, severe allergic reaction, severe dehydration, or heart problems. When blood flow is significantly reduced, the body does not receive an adequate supply of oxygen, and shock occurs. Individuals experiencing shock may lose consciousness or fail to respond. Signs and symptoms of shock include poor skin color that is pale, gray, or bluish, dizziness and lightheadedness, nausea or vomiting, behavior change such as agitation, confusion, or unresponsiveness, and clammy skin. When you are to take care of someone suffering from a shock, you should first call 911/EMS. Then, help the individual lie down and elevate their legs. Cover them with blankets to keep them warm. Be prepared to perform CPR and stay with the individual until help arrives. This concludes our lesson on shock. Next,